Ribs are vital parts of human skeletal composition. They are part of the thoracic cage, which includes the thoracic vertebrae posteriorly and the sternum and the costal cartilages anteriorly. The main function of the ribs is to shield vital organs, such as the heart and lungs in the chest, in addition the liver and stomach in the upper abdomen. The entire thoracic cage is flexible because the ribs slant downwards. The bottom of the thoracic cage is contracted and flattened by the diaphragm when breathing, while the intercostal muscles contract and lift the rib cage up and out. Also, the attachment to the sternum allows the ribs to change volume during breathing. There are 12 pairs of ribs. All ribs attach to the thoracic vertebrae posteriorly and run anterior-inferiorly to reach the front of the chest. The superior 7 pairs of ribs join directly to the sternum by the cartilaginous extensions, which are the costal cartilages. For that reason, these ribs are called true ribs or vertebrosternal ribs. The inferior 5 ribs, which are numbered 8 through 12, are called false ribs because they attach to the sternum, indirectly or at all. Among false ribs, there's a distinction. Ribs 11 and 12 are called floating ribs or vertebral ribs due to lack of anterior attachment. Instead, their costal cartilages lie embedded in the muscles of the lateral body wall. It is important to understand the composition of the thoracic cage by examining the rib on itself. Ribs are classified as typical and atypical in their structure. This video will focus on typical ribs as there are more of them. Typical ribs are numbered 3 to 10. Starting from the posterior side, the rib has a head which attaches to the vertebral bodies by 2 facets. One facet joins the body of the thoracic vertebra of the same number. The other joins the body of the vertebra to the superior costal facet of the vertebra. Following the head of the rib is a narrow part, which is the neck of the rib. Right after the rib's neck is a distinct eminence called the tubercle of the rib. It is a distinct part of the rib which articulates with the transverse process of thoracic vertebra. It has articular and non-articular facets. The articular facet is smooth and it makes contact with transverse costal facet of the vertebra. The non-articular facet is more rough in its appearance and its function is to give attachment to the ligament on the tubercle. Past the tubercle is the curvature which changes. That curvature is called the angle of the rib. Following the angle of the rib is the body of the rib, also referred to as the shaft. The shaft curves sharply anteriorly. The medial end of the rib contains an indentation that attaches to the costal cartilage anteriorly. The costal cartilages provide secure but flexible attachments of ribs to sternum and contribute to the elasticity of the thoracic cage. Looking inferiorly, The rib has a sharper margin, which helps identify the costal groove. That's where the intercostal nerves and vessels are located. When examining the superior side, the margin is rounded and smooth. Ribs can be broken and can puncture the lungs and cause air leakage and difficulty with breathing. Rib fractures are common due to trauma where great pressure is exerted on the ribs, resulting in broken ribs. When ribs are broken in several places of the thoracic cage, such injury is called flail chest. Flail chest results in sections of detached or broken bones floating separately from the rest of the thoracic cage, causing great pain when breathing. This video identified the distinctive features of the ribs. It also differentiated true ribs from false ribs and floating ribs. In addition, it described how a typical rib attaches to the vertebral column, and it discussed the clinical significance of the ribs.